Good afternoon everyone. Today I am going to demonstrate about the pharyngeal arches. Pharyngeal arches are rod-like thickenings of mesoderm present in the wall of the foregut. Mesoderm, which is derived from the pharyngeal mesoderm and lateral plate mesoderm. Each branchial arch consists of outer ectoderm, central mesoderm and inner endoderm. At first there are 6 arches. The 5th arch disappears and only 5 remains. The ventral end of the arches of the right and left side meet in the middle line in the floor of the pharynx. In the interval between any 2 arches, the endoderm is pushed outwards to form a series of pouches called the pharyngeal pouches or endodermal pouches. Opposite of each pouch, the surface ectoderm dips to form the ectodermal clefts. In the first arch, there are 2 lingual swellings which are separated by the tuberculum impar, from which the anterior 2/3 part of the tongue is formed. This is the foramen cecum, which overgrows and forms thyroglossal duct, from which the thyroid duct gland is formed. This is the hypobranchial eminence, from which the posterior 1/3 part of the tongue is formed. This is the epiglottal swelling. This is laryngeal orifice, and this is arytenoid swellings. First arch or mandibular arch, skeletal element, cartilage or Meckel's cartilage gives origin to incus, malleus and sphenomandibular ligament. Muscles of mastication, tensor villi palatini, anterior belly of digastric and myohyoid muscle, nerve, mandibular nerve and artery, maxillary artery. From the second arch or hyoid arch, skeletal element includes stapes, styloid process, stylohyoid ligament, muscles, facial muscle, stapedius, posterior belly of digastric, stylohyoid muscle, nerve, facial nerve and artery, stapedial artery and hyoid artery. From the third arch, skeletal element, greater cornu and lower part of body of hyoid, muscle, stylopharyngeus muscle, nerve, glossopharyngeal nerve. From the fourth arch, muscles of pharynx, superior, middle and inferior constrictor of muscles of pharynx, nerve, superior laryngeal nerve. From sixth arch, all muscles of larynx and recurrent laryngeal nerve are derived. External acoustic meatus develops from the first ectodermal cleft. First endodermal pouch gives off a diverticulum called as tubotympanic recess. Palatine tonsil develops from the second pouch. Inferior parathyroid gland and thymus develops from the third pouch. Superior parathyroid gland derived from the fourth pouch. Remnant of fifth pouch give rise to ultimobranchial body.